This program is brought to you by North American Sleep Medicine Society. Please visit us at nasms.org.
There is a close association between sleep and epilepsy. Sleep is very important for keeping our bodies healthy. When we don't sleep well, our brains don't function well. As a matter of fact, all the organs won't function properly. Although epilepsy often contributes to sleep difficulties, many epileptic patients exhibit one of several different types of sleep difficulties independently of their epilepsy. A careful history helps to differentiate the causes of such sleep problems. Comorbidity between epilepsy and sleep disorders has been shown to exist, and in these cases, resolving the underlying sleep disorder may in turn affect seizure control. One study by Dr. Tachan and collaborators compared 80 patients with epilepsy with 17 healthy, age-matched, sex-matched, non-epileptic controls. Even in the absence of seizures activity, sleep in the epileptic group was characterized by a marked instability compared with normal subjects. Overall, the patients with epilepsy in this study was decreased sleep efficiency compared with controls without epilepsy. Example, the ratio of the time they were asleep compared with the time that they were in bed was diminished. They experienced an increase in sleep stage shift, moving in and out of sleep. Both the number and the duration of awakenings increased. These parameters were most effective in untreated newly diagnosed patients. So these sleep disturbances were not likely the results of anti-epileptic treatment side effects. It is apparent that epilepsy may have a direct adverse effect upon sleep even when seizures are not taking place. There has been a tendency to blame anti-epileptic drugs for sleep disturbances because of sedation and other side effects, although the study by Tachan and collaborators and other studies contradict this idea.
In some epilepsy syndromes, seizures occur predominantly, or even exclusively, during sleep or on awakening. Excessive daytime sleepiness is common in patients with epilepsy, and may be due not only to medication, but also to nocturnal seizures or concomitant sleep disorders. Sleep disorders can worsen epilepsy, with improvement of seizure control following appropriate treatment of the sleep disorder. Conversely, epilepsy and anti-epileptic treatment can worsen sleep disorders. Nocturnal epileptic seizures may be difficult to differentiate from parasomnias, in particular non-rapid eye movement parasomnias, such as night terrors, sleepwalking and confusional arousals, on history alone. Since there are semiological similarities between the two, performing a polysomnography, we have less chances to misdiagnose an epileptic patient.